Hey everyone, welcome back to the Neuro Wellness Podcast. It's your host, Dr. Joe. Today I'm joined by my guest, Dr. John Hatch. Thank you for joining me today.
Thanks for having me.
Yep, of course. Dr. Hatch, remind us, where is it in the world that you are practicing currently?
I am currently practicing in Orem, Utah, which is just south of Salt Lake City, Utah.
I bet it's beautiful out there.
Mm-hmm.
Yeah. So the main topic of discussion that we wanted to discuss today was sleep, and specifically sleep supplementation. Before we dive too heavily into that, I always like to ask my guests, how did they get into this field of the neurology, and what's your passion in this field?
Absolutely. Thanks, Doc. That's a great question. As you can tell, I'm passionate about life in general, but the field of neurology has opened my mind to whole new heights. I was in general chiropractic school thinking I was just going to rack 'em, crack 'em, do structural stuff. And then I had a distinct impression that I needed to help sick people get well. And my wife at the time had been diagnosed or had severe chronic migraines for 22 years. No one could figure it out. She'd been to every doctor's. They finally diagnosed her of herpes of the brain. They had literally no clue what was going on. And then she got adjusted by a chiropractor that specialized in an upper cervical adjustment, and she was put in the hospital for 3 days. And the doctor said, "Oh, it's retracing, it's normal." And I'm like, "No, that's not normal." And then I really started studying, and then I had the opportunity to listen to one of Dr. Ted Carrick. He'd come to our school and presented, and that's what changed everything. I turned my entire field and direction of sports and injury-based chiropractic to functional neurology. I started treating my first Parkinson's patient and got her tremor to stop after 3 years of a tremor to stop in 2 weeks, and her to ride a bike again and have life back after she had been everywhere and nothing's working. And so then that just put my field and my life in neurology, and I've never been a general chiropractor since. I mean, I've been in the field now 9 years in clinical as a doctor, and I've done functional neurology and only functional neurology since day one. And it's been so incredible to watch the change. Right now, the heavy things that we obviously all treat with anxiety or concussions and other things, but primarily our clinic sees a lot of anxiety, suicide, depression, the severe psychological imbalances due to post-head trauma that people don't correlate it with. So that's where my passion is where my life is where my study is. Everything I do is, how does the brain work? Why does the brain do that? And how can the brain repair itself if you give the right information?
Mm-hmm. That's fantastic that you're doing the work that you're doing and helping the people you are. Such a needed thing. So that's great. You mentioned TBI and brain health in general. I know our overarching topic of discussion today is sleep. Can you talk about why sleep is important for TBI as well as other brain-related conditions?
Yes. The biggest thing is we all know that anybody who's studied the brain at all, the cerebellum is the most highly involved in everything that we do. Like when people say it's all cerebellum, it was almost annoying in school when they were like, it's all cerebellum, it's all cerebellum. Well, it actually is true. The cerebellum literally fires at everything. I mean, when we got 69 billion neurons in a little tiny organ called the cerebellum, and yet 19 plus billion in the rest of our cortex, obviously that cerebellum is doing a ton. And the cerebellum converts and heals and repairs and fires correctly while you're sleeping incorrect amount of sleep. So I have seen so many traumatic brain injuries and so many other illnesses and imbalances, right? Because they can't sleep, they can't recover. I think it's funny that we get concussion, and what is the first thing the natural human brain wants to do when you're concussed is sleep. And for so long, they were like, don't let him sleep. And it's like, okay, that theory's been ruled out. Let's be honest, let him sleep, let him sleep. They let him sleep for 2 to 3 weeks, and then the brain does the reverse. it goes into the opposite like spectrum, and then it can't sleep, it can't fall asleep, it can't stay asleep. So the cerebellum doesn't recover. So short-term memory gets affected, high executive brain function gets affected, and then we can't suppress unwanted thoughts, and it just creates this whole cascade. And I had been working on so many brains that we would fix all the pathways based in neurology and what we can diagnose and find, and they still weren't sleeping. And I was like, how is that possible? Like, I believe in pathways so much that if I activate the right pathway, the change in the result is inevitable. Like, it should change. And so that's what made me study how sleep actually functions, how we're supposed to sleep, what we're supposed to sleep, what neurotransmitters are involved in sleep, what neurochemistry is involved in sleep. And then I just like, it dove me into so many different things, and I had seen so many great results. But for the occasional patient that brain health or brain exercises alone couldn't help them sleep, I had to find something that, like, what is our brain's neurochemistry that makes us sleep, that puts us in that sleep stage. Like, just recently, last week, I discovered what creates that autopilot transition from when you're falling asleep and people get that startle response right before they fall asleep. Like, why is the brain doing that? Like, I'm just trying to discover every reason why we do what we do. Like, the brain doesn't do it synaptively because it's like by chance. It's like, oh, all of a sudden I have a left tick. Like, why are you ticking? There's a specific thing the brain's looking for or firing to get that feedback. And so that's something sleep has been a huge one for me, because no one can escape it, and we can try all we want to sleep less. If we don't get enough sleep, our performance is hindered. So
Yeah, I agree wholeheartedly. Sleep is one of my favorite topics to talk about. So I'm really glad that we're touching on this now. And that's interesting. You were saying that even though you would fix a lot of the diagnosable pathways in your clinic, you still had problems with, people were still having trouble sleeping, right? And you
yep,
mentioned the neurochemistry of sleep. Can you give
yep,
us a quick overview or deep
yeah.
overview
This
into
is
the
again, this
neurochemistry of sleep?
I would love to. So there's, like, everyone thinks melatonin when they sleep, right?
Mhm.
Well, there's enough neuroscience research out there. That's where I discovered all of this, is that it's not just melatonin. Melatonin has to react with norepinephrine to create a symbiotic balance between norepinephrine and melatonin to be stable. But the hypothalamus, where the sleep awake center is controlled in the brain, also has to secrete GABA and serotonin, and GABA and serotonin have to connect with norepinephrine and balance there. That's why people take 5-HTP and it doesn't help. They take gabapentin and it doesn't help. They take 12 milligrams of melatonin and it doesn't help. And it's like, well, you got to have the right recipe. Like, you need all three to come into unity to balance that norepinephrine to create a healthy chemistry. And I truly believe with concussions, as we know, one is the biggest side effects in concussions, especially females, like 85% create a pituitary adenoma. It's like 55% in males. So if that's truly the case, and there's a pituitary adenoma, we know the hypothalamus is going to alter its functionality, which would then alter all those ratios. And so I'd fix pathways, and I'm still dealing with a ratio. And I feel like if you give the brain the right recipe, the brain starts to learn, oh, I need this much melatonin, this much serotonin, this much GABA, and I can stabilize it. And once that occurs, people sleep through the night. And it's amazing because, I mean, I'm a component of it. I've had 13 concussions in my life. I'm not a person who's like, I've never had one of these. I had one that I was blacked out for 18 hours of my life. And I came to, and I've always had struggles with falling asleep and never staying asleep, but problems falling asleep and problems waking up. And now, I mean, I have 3 kids, and I wake up in the middle of the night and I can still take my supplement, fall asleep, wake up, take care of the kids, and go right back to bed, and then wake up. I can take it whether I have 2 hours of sleep that night and that's all I get, or if I get to sleep 9 hours that night. I feel rested, I feel rejuvenated, because the chemistry of the brain is stable, and it's like, oh, okay, today you only get 2 hours. All right, we'll make some adjustments today, and then the next day you fall asleep. It's not like a continual imbalance. But those 3 neurotransmitters, melatonin, right, and then serotonin and GABA, and then norepinephrine, are so need to be intertwined. And right, then you get blood sugars involved, and you got cortisol, right? And melatonin and cortisol are opposites of each other. So then you start looking at the cortisone pathway. There's so many other things to be involved. We could go down a spiral for blood sugars and all these other things that every person has tried. I found that when you get those three ratios right, a person can get restorative sleep.
Mm-hmm. And you've created a supplement that combines these three neurotransmitters, correct? So I was going to ask, how I guess did you come to the appropriate ratios? How long did that take, and where did you?
That took a lot of time because the research and it's not really clear. They're kind of like, well, like, we know you need these neurotransmitters, like, good luck. And so I just started seeing, like, on different patients and different brain pathways, and I was kind of trying to discover, like, all right, melatonin is only secreted by the pineal gland, so it's an individual organ. It doesn't do much else. It's like just this little drip system. So as I've studied the different demands of the brain while sleeping, right, cerebellum is the most involved, which is where most of your GABA is produced. So I started creating ratios just based on how brains function. And what I discovered was a ratio of a higher dominance of GABA with a balanced serotonin, then a very small trickle of melatonin makes all the difference in the world. And so the ratios I discovered on my own, are they 100% accurate? Well, I don't know if any of us know that, right? I mean, but what I'm basing it off is what we know about the brain and how it functions. And so I had to create ratios based on that. And so we know GABA doesn't, cross the blood-brain barrier. So I had to create a supplement that had all the substrates to get it there, right? And because, like, the brain likes recipes, when it's all in one pill, it's all together, and the body kind of sees it and goes, oh, I know what this recipe looks like. It helps so much. I learned it from a medical neurologist in Texas, and he talked about how the brain likes recipes. You don't give one without the other. You need the recipe. The recipe matters. And formulating that recipe is my next, like, constant progression. As new neuroscience comes out, if we discover, like, specific ratios that are perfect, in what I see, this is what I've discovered. But for other people, they might need, like, some other neuroscience research that might prove even more the actual ratios. Mm-hmm. That's been the hardest part, because the research is, like, almost non-existent.
I can imagine. Yeah. What so far, what has the patient feedback and maybe your own feedback been like since implementing the supplement?
It's been crazy. The amount of patients that are getting, like, better sleep than ever is honestly astronomical. It almost got to a point where every patient walking in the office was like, dude, can I get some deep sleep? Can I get some deep sleep? And what's incredible is the people it doesn't work on, their brains are broken. I've had patients tell their family about it, and they start taking the supplement, and they're like, I'm not noticing any difference. And I'm like, that's because your brain's not working. You got to get your brain working before you can get the ratio working, right? That's why the medical world has Ambien and trazodone and all these things that help people knock people out so that they can sleep. But as these patients would come in as patients later, I'd look at the test and be like, all right, don't start the supplement yet. Let's get your brain working. Once the brain's working, then we put the supplement in, and it's really quick and really easy. And that's the nice thing is someone can actually determine how well their circuitry is working in their brain, the restorative sleep pathway, just based on, hey, I haven't slept. Let me take the supplement. If I sleep really good, hey, my brain's working pretty good. I just need the chemistry balanced right. If someone takes it and goes, I notice no difference, they know right away there's brain exercises that need to be done. There's things that need to be rehabbed to their brain. And then they can take the supplement so it actually learns the correct ratio and the correct pattern. Okay. It's been really awesome. Like, I personally have been in the field for 9 years and have used so many different sleep supplements. And as we know, there's been supplements that have been taken off of the market that used to work incredible. And yet I haven't seen a product work as good as ours does currently with the patient base that we're seeing. And so I've been really pleased. Like, it's been incredible to watch.
Yeah, that's awesome. And I think you alluded to it a little earlier, but I just want to touch on a lot of things can help people fall asleep. You mentioned,
Mhm,
trazodone, things like alcohol as well can help people
mhm.
fall asleep, right? But not everything that helps someone fall asleep or knock someone out is going to produce a good quality of sleep, right?
Yeah, I actually
Alcohol. So go
a
ahead.
great. I have a patient that was just here 2 weeks ago, and it was pretty amazing because he's kind of like a Red Bull, like BMX biker that does like rampage style, like gapping huge things. And
Hmm.
he's like, I started getting anxiety and I can't sleep and I have severe anxiety. And I'm like, you probably got a concussion, buddy. Let's go see what your brain is. He's like, no, I didn't. He's like, I fell, but I didn't hit my head. And people just don't associate that when they roll on their head, that's not a concussion, right?
Hmm.
So he had been taking Ambien every night and knocking out, but waking up so jittery and so like fatigued, and the brain, his anxiety was off the charts. And I said, okay, keep your medication, right? Because that's what's working to get you to knock out, but it's not getting restorative sleep. So we spent a week of doing brain exercises, got his brain stabilized. He still needed the Ambien to sleep, which was great. And then I said, now start on the sleep supplement. It's just a nerval supplement to just like coexist with it. And it was amazing. Him taking 4 pills of the supplement and the Ambien not only knocked him out, but he woke up and was like refreshed. There was no like get up after the Ambien and feel like I've been hit by a Mack truck, right?
Hmm.
And he's like, dude, I've been waiting for this type of sleep this whole time. And now his brain is healing even faster. So that anxiety and everything else is coming down as well. So you get that restorative sleep and it really changes. Again, like you have seen, I have so many patients on so many sleep meds and they're like, I just feel so exhausted. Yes, it's knocking you out, but you're not restoring pathways. That's when
Hmm.
I've learned. That's why I created the product that we did, is because I got to find a way to restore. And again, I'm a big like database. I have a Whoop that I do
Hmm.
triathlons, and I'm always testing like, how am I recovering? How's my sleep? I only got 4 hours of sleep, but I spent half of that in deep sleep. Like, it can track it. So I've
Hmm.
seen what like my patients or people that have one of these, I can see like when they take their supplement, when they don't take their supplement, how much recovery happens, how much do they sit in REM sleep versus deep sleep. It's like quantifiable.
Hmm.
So it's been game changer for me personally and my other patients that have one of these. Now, I'm not saying everyone needs one of these, but it's a great indicator of how well a supplement is actually doing its job or not.
Right. Yeah. And I was actually going to ask if there's any biometric data that you've been monitoring. Like the Whoop is great. So that's awesome that you've noticed
Yep. And there's
some changes
BioStrap,
there.
and you can use any
Hmm.
company, any product out there that tracks like sleep and can differentiate those heart rate variabilities. I
Hmm.
mean, it's been a real game changer. What's incredible too is because I have kids, people always ask, was it going to knock you out? And then like, what if I have a kid who needs get up? And I mean, I wake up, take care of my kid, change its diaper, give it a bottle, and then I lay back down and I'm back to sleep instantly. It's not
Hmm.
like, oh, now I'm laying here for an hour, now I'm awake, right? Which happens so often.
Hmm.
So
Um, with most supplements, one thing I always like to ask or wonder about is, is this something that is going to be therapeutic, or is this something that is going to become kind of a crutch or a dependency?
yeah, great
Um,
question.
yeah.
That's awesome because now you know my true heart. I
Hmm.
actually created a product that shouldn't be a crutch.
Good.
I mean, they literally can take it or not take it, and it'll have no side effect. Like,
Hmm.
if someone takes it or doesn't take it, like once the brain is restored, I truly believe once the system knows the three, if if they probably don't need to take it. A lot of times I'll tell people take it for 3 months and then go a week or two without it and see how you do. Some
Hmm.
people are so like connected to their supplement that they're like, I got to take this and I got to take it every night, right?
Hmm.
I used it heavily for the first 3 months because you and I know about neuroplasticity. And I create 3 months of hardwiring in the brain. And then after that, there'll be days I take it and days I don't take it. And I'm still seeing great results on this because the own system is working. I do know that when I have a bad night's sleep, I don't
Hmm.
take any chances. The next night, I make sure I take my deep sleep to get that restorative sleep because I never want 2 days to pass. So
Hmm.
that's kind of how I use it. I use it on based on this and what time did I fall asleep, or say I fell asleep putting my kids to bed and I wake up and now I'm awake. If I've been awake more than 15 minutes, I'll go into my little night by my nightstand and take my supplement, and I know my brain will go right back to sleep. Sometimes there's stress involved. Sometimes you're worried about something in the business. You're worried about other things in life. So it's been awesome. Like, not that it's a crutch, it's there if you need it. I
Hmm.
have patients that have been taking it for 8 months and they're like, I swear by this, I'm not going a day without it because that's what they love. And then other patients, I just had a gentleman in here that I'd been working on for a year and a half and couldn't get into sleep. He'd been on the supplement for 2 months and he's sleeping like a champ. He's like, I've never slept this good in my life. And I'm like, okay. He's like, well, do I have to take it for the rest of my life? I'm like, well, actually, every test looks better than it ever has. Go a week without it and see how you do and base it on that. If you need it another month, then take it another month. If you stop and it's awesome, you don't need it.
Hmm.
Because once the brain learns the ratio, it can self do it. It
Hmm.
can do it on its own. So it's not something that's 100% like, it's not, you should never be dependent on it. If you're
Hmm.
dependent on a supplement of any sort, I believe that means your brain's still not healthy or your gut's still not healthy.
Hmm.
That's how I feel with what we know about neurology. So
Yeah.
that's the long answer is it's therapeutic usually in that first 3 months while I'm wiring that brain. And
Hmm.
then depending on how bad their gut is, how bad their chemistry is, right? Let's say hey, they have the MTHFR gene and they can't methylate and they're not going to create serotonin. The likelihood of they needing that for a while is probably high
Yeah.
because they can't create the right serotonin to all those ratios, right? So I'll keep people on it, but then once they stop, they can stop. And it's not like I had withdrawals. Right? It's been really nice. Once the brain works, it'll hold it.
Yeah, that's great. And I think that's what, most people want. And no one wants to be dependent on anything, not our therapies, not, a
Mm-mm.
drug, a supplement, anything. So that's fantastic. Now that we've touched on kind of getting better sleep, can we touch on a little bit on why sleep is so important, just in general? I know, from the immune system to cognition to adipose tissue to cravings, everything. Uh, it can we touch on that a little bit?
Yeah. Yeah. I mean, that's why I got into this realm of sleep is because I realized sleep is probably the one of them next to stimulation. They're the two most important things in our lives. And our society and our fast pace of life is just like, oh, I can function on 4 hours or 5 hours. Yeah, right now you might. But what you're doing to your brain over time is a ticking time bomb,
Mhm.
right? So the the cognition, the hormone stability. I mean, I feel like short-term memory converted into long-term memory happens while you sleep. Like
Mhm.
in school, we used to cram and then not sleep and then go take a test, and you actually don't retain as much as if you had a good night's sleep. You're better off stopping and going and studying. So, from a high executive mindset, the sleep is the most important thing that you can do because your everyday life can usually hold you as well as you can. I also find that again, like you're suppressing your unwanted thoughts during the night. If you don't sleep, you can't suppress those unwanted thoughts. So if you got fears and you got stressors, those are going to be a huge imbalances, right? If your melatonin can stay high through those 8 hours, your cortisol also stays low. So then you have a normal circadian rhythm and a normal cortisol rhythm to help with blood sugars. And that's where the adipose fat comes in. Tissue repair, it happens while you're sleeping. The endless like benefits of sleep. I mean, hormones, specific hormones aren't released until you sleep 7 hours. So if you're sleeping 6, you're not releasing those hormones. So then that's going to create another problem, right? In female cycles, infertility, like the list goes on and on and on. But the biggest thing I have seen is just the cognitive function and brain fog and brain fatigue. Like people always say, I'm just not as mentally clear. It's probably because I'm old. And I'm like, 9 out of 10 times it's because your cerebellum's blown out and you're not sleeping well. And they're like, really? I think I get great sleep. I'm like, I look at their brain tests and I'm like, you might be sleeping, but you're not recovering. They're two totally different things.
Mhm.
And so, I mean, for me, sleep is everything. I mean, some of the coolest books I've read about like peak performance, they talk about for every 1 minute of sleep, you get 2 minutes of performance, right? So if you got 8-hour workday, you got to sleep, 4 hours to even just function on that 8 hours. But
Mhm.
you're awake 16 hours of the day in general. So
Mhm.
you should be sleeping 8 hours minimum for
Yeah.
16 hours of performance. So that's
Yeah.
the beauty that, so those are the biggest like changes that I've seen is recovery, gut function, hormones, like it all happens during the brain function.
Yeah. And you mentioned when you're in school, you would cram or you would stay up late at night, and that doesn't provide the right opportunity for short-term to convert to long-term memories. And I think in our culture in general, I think it's almost desirable or it's admirable to not sleep. It's like, oh, I only slept 2 hours last night and I got up and, cranked away at this. You're
Yeah.
really doing yourself a disservice at the end of the day because you might
Mhm.
have a greater quantity of hours in the day, but the quality of those hours is, vastly diminished.
Yeah, it's kind of like it's become a badge of honor.
Mm-hmm.
Guys, I only slept 3 hours last night. Like I
Mm-hmm.
even find myself doing that sometimes. I come back, oh man, I only got 3 hours of sleep last night. That shouldn't be something we're proud of. It shouldn't
Yeah.
be anything. That's definitely true. And if you think about the aging brain in general, right? Glucose, blood glucose, where they're saying like Alzheimer's is like a type 3 diabetic, right? If your cortisol levels are too high, your insulin resistance is going to go up and you're just baiting yourself for an age-old brain. And I think we don't need, and we might physically get old, right? We might lose hair, we might get more wrinkly, our skin might sag a little bit, but our brain should be higher intellectual at 60, at 70, at 80 than we are at 20, 30, 40. Like that's where the elite, like people that do research, some of the professors in our field, like Dr. Carrick and others, like they're aging and yet they're learning new things and coming up with new ideas because they're pushing their brain to
Mm-hmm.
new heights and new levels in whatever field of health there are, right? So
Yeah, I agree. Fantastic. Um, in addition to the deep sleep supplement, if you were to give somebody like a recommendation for them to achieve the perfect night's sleep,
yeah.
what would what would that approach look like?
Yeah, great. So I always like, I'll give you like my 3 favorite brain exercises that I use for sleep specifically. Because of what I've studied in neurology, that's what led me to this supplement. I believe, honestly, we created one of the greatest sleep supplements there are on the planet because of all the research that I've been trying to pull out from everything to create the right ratio, right? Some patients, they need my supplement plus more melatonin because their pineal gland is shot, right? They've used too much melatonin over the years. So they have to take that with the melatonin. That is kind of like a variation that I've seen because my product doesn't have a ton of melatonin because I just want the ratio right so the body can produce it itself, right? That's sometimes people's biggest problems. But as I've learned, as you know, in sleep, there's 3 primary pathways that run while you're sleeping: the vestibular, pulmonary, cardiac system, the vestibular cerebellum system, and the spinal cerebellum system. These 3 pathways are running constantly. So I always look at just like we do with a baby, right? I rock my baby constantly before he falls asleep. And when he gets really restless, I rock him. Why do we toss and turn through the night? Why do we need weighted blankets? Weighted blankets work because they put pressure on the skin and the spinal cerebellum pathway. Like I always ask people, like, do you like a ton of blankets or no blankets? If they like a ton, their spinal cerebellum pathway is low. If they're like, oh, I don't like blankets, I don't like anything, their spinal cerebellum's too high because the other two systems aren't working. So when I go to the vestibular cerebellum pathway, I'll use a lot of just vestibular, like vestibular ocular exercises, no-nos, different things to get them to brain to calm down. You can't have them count sheep because they're going to get into their cognitive mind. I have them just move, horizontal movement, no different than, again, we all rock our babies. It's innately taught us how to take care of a child or help a child sleep. And then obviously extreme breathing. I think the ribs and the thoracic system needs to move appropriately, right? A lot of sleep apnea and all these things, they're just trying to get oxygen, but the person doesn't move their lungs, like get their lungs moving, get their ribs moving, where like a chiropractic adjustment does incredible, right? So there's a lot of breathing technique exercises, head movements, and then different type of spinal cerebellum activation, right? People grind their teeth at night. So the jaw is heavily affected in activation of sleep. So between jaw and head movements and breathing, you do those three to activate the brain, and then add supplementation, and you can knock sleep out. I mean, I do this all the time. I'm, again, race day, people get excited, right? First day of school, kids get excited, they don't sleep. If they activate their brain, they can calm down that cognitive mind and allow it to sleep. I use it all the time on race days. Day before a race, your brain's going, you only want to sleep 2 hours. If you sleep 2 hours, you're going to bonk on that race. Mm-hmm. So I'll do brain exercise, a lot of no-nos, just back and forth, activating that vestibular pathway, and it'll put me to sleep in the process. So
that's great advice right there. Yeah. I'd never thought about doing some of those things before bed, so that's a great suggestion there. So,
yep.
Dr. Hatch, we're just about out of time. I wanted to make sure to leave you with enough time to let our audience know how they can find out more about you and the products and services you offer, and any final thoughts you might have on the subject of sleep.
Yeah, absolutely. My biggest thing to all those that are listening is don't accept poor sleep. Don't accept, I wake up and I need a new mattress, I need a new pillow. Your brain is controlling that. If you sleep and all of a sudden you had a bad night's sleep, it's because something else is going on. You don't all of a sudden have a bad night's sleep on a bad mattress. It doesn't just all of a sudden go bad overnight. What is your brain doing? How is your brain working? And what are you doing to use this mind of yours, this incredible brain that you have, to fulfill and perform at your highest level? And the best way to perform and to measure your performance is how well you're sleeping. When people can't sleep, they're not performing right through the day. So it's kind of like a catch-22. To perform right, you need to sleep. But in order to, if you're sleeping right, you know you're performing right. So they go together. So ask yourself, how am I really sleeping? What are some exercises? What are some things I can do to my brain? And then, is there some supplementation on top of what I'm currently doing that might help my chemistry even more? Mm-hmm. And that's the biggest thing that I've seen. And what I hope is everyone can sleep. I don't think there's a person on the planet that can't sleep. Our brains are programmed to sleep. Even infants, I get patients in here at 1 year old and they're like, kid hasn't slept all, we just rock him constantly. And as soon as we rock him, he doesn't sleep. And that's because of a different pathway. And there's ways to repair that. There's ways to change it. Get the child to activate. I work with a lot of infants who don't sleep, and you activate the correct vestibular system, and it makes all the difference. Again, if you have any questions, listen to this again, share it with friends. You can go to our website at brainrehab.com, at thebrainrehab.com. I'll make sure I get it right. thebrainrehab.com, and it can give you all the information that you might need on top of what you're already doing. There's always an answer. Even if we don't do it, somebody else has some information. Never give up. There's always hope.
That's great. Yeah. Well said, Dr. Hatch. Well, it has been a pleasure discussing sleep with you today. I think our audience is going to learn a ton from this episode. So like you said, maybe this is a good one to re-listen to. Great stuff here for everyone. So again, thank you very much for being on today.
Thank
It's
you.
been great. So this has been your host from the Neuro Wellness Podcast. Be well.